Well, welcome to the Daily Brief on Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce, and powered by Aurora WDC. I'm Tim Sheehy, president of the Metropolitan Milwaukee Association of Commerce, and I'll introduce in a moment my co-host, Dr. John Raymond, who is president of the Medical College. So each day at 3:30, you can count on a fact-filled 19-minute update on the health and economic impacts of COVID-19. We're also going to be joined today by our guest, Ryan Festerling, the president of QPS Employment Group. And Ryan has 20 years of experience in the human resource area with Kohl's, most recently as their executive vice president and chief human resource officer. But as we do every day, let's start with a healthcare update from Dr. Raymond.
Thank you, Tim, and welcome everybody. Good afternoon. I'm going to touch on two topics today. The first will be our COVID-19 scorecard update, and the second will be a brief description of the types of COVID-19 tests that are either available or being brought to market. MMAC is working to provide you with meaningful information to track the spread of COVID-19 here in our region. And we've decided to provide you with a scorecard each weekday for which we'll share the number of new cases and the doubling rate of new incident cases, both in Wisconsin and in Milwaukee County. Recall that yesterday we showed data that hinted that our daily growth rate and doubling rate may have showed some preliminary signs that they were beginning to flatten the curve here in Wisconsin. Last week, the daily growth rate was tracking at about 30 to 35% of new cases, with a doubling rate of about 3 days. Yesterday, the numbers looked better, but we cautioned that there was a possibility for delayed reporting over the weekend. I'm pleased to report promising news today that the daily growth rates have dropped to 16.6% in Milwaukee and 16.8% in Wisconsin, and that the doubling rates have extended out to about 4.1 days, both in Milwaukee and in Wisconsin. I'm cautiously optimistic. But there's still a possibility for reporting lag. So tomorrow's numbers are going to be very telling. And later in the week, we promised to add trend lines to the scorecard. Now, we'd not expect that there'd be a measurable impact of social distancing interventions or any flattening of the curve until 7 to 10 days after implementation of social distancing measures, primarily because of the long asymptomatic phase of the COVID-19 infection. But a flattening of the curve is consistent with the timing of recent interventions here in Wisconsin. Recall that our educational facilities were closed on March 18th, around the same time that many bars and restaurants were closed. And on March 25th, we implemented stay-at-home orders with the closure of non-essential services. So what does this mean for us? First and foremost, we need to establish that the trend is continuing. But if it does, that means that social distancing is beginning to work here in Wisconsin. But it also means that we can't relax. If anything, we need to redouble our efforts to slow the spread. The number of cases are still rising in Wisconsin and in Milwaukee, and we expect them to continue to rise for weeks or longer. We're focused sharply on flattening that curve, and we're in the first mile of a marathon, and we have a long way to go. Now for the second topic, if we could go on to the next slide, please. I'll give you some basic information about the two types of COVID-19 tests available now, or which are being brought to the market. Now, most of the currently available tests are nucleic acid-based tests that detect the presence of COVID-19 DNA in nasal swabs or in body fluids. In other words, it tests for the presence of the virus. These tests give a turnaround time that's measured in hours. Some of the slower tests in this category can be run on commonly available instruments, but the turnaround time is relatively slow, and that would be measured maybe up to a day. Newer tests of this type have more rapid turnaround times, like those from Abbott and Cepheid, but these also require specialized instruments. And I do want to emphasize that these newer tests, in practical terms, are not actually point-of-care tests. Collections and processing require PPE and very significant handling precautions, and they must be performed in a laboratory. And there are other limitations to these new tests, including unavailability of the specialized equipment and shortages of critical reagents, which we hope all will be addressed soon. These new tests do have other limitations, such as the need for running tests in small batches and the limited capacity to run simultaneous samples. Nevertheless, there's some promise there. Now, if we could go to the next slide. The other type of testing that's getting quite a bit of press is called serological testing, and this involves detecting antibodies to COVID-19 in human blood. These can be simple tests that require little to no equipment, and there is a potential for these tests to have a rapid turnaround time and true point of care testing. But the tests have limited utility as of today. Let me explain why. First, they require an immune response to develop. And that immune response might not be detectable in asymptomatic patients, and there may be a lag time of up to 7 to 10 days, even after symptoms occur, before the acute phase IgM antibodies develop and are detectable. The lag time for the convalescent IgG antibodies might be as long as a few weeks. And there still are reports of persistent virus, even though convalescent antibodies to COVID-19 are present. Finally, the specificity of these serological tests is not well established, and there could be theoretically cross-reactivity to other viruses. So the bottom line is that these tests could be helpful. We hope they will be, but there are many questions that need to be answered before they can be deployed intelligently to the front lines. If we could just go to the next slide, there's some information on what your employees can do if they think they need to be tested. Thank you, Tim.
Thank you, Dr. Raymond. Just two quick follow-up questions. In the 2 weeks that we've been doing this is the first time I've ever heard the words cautiously optimistic from you. And so just a comment on that. And then since this should have been past opening day, if you can give us a sense of, and maybe not a fair question right now, but what inning are we in?
We're probably in the first or second inning, Tim. We've got a long way to go. I'm optimistic because I think we're going to save lives here if we continue to do what we're doing. And I personally believe that the health and well-being of our population is 100% aligned with our economic viability. And I also think that just being prepared that this is going to be a long fight for us, that's just the smart thing for us to do, Tim.
Okay, so I just wanted to level set there. So cautiously optimistic doesn't mean that people are going to come back to work next week.
Well, if it's opening day, we're all optimistic, right? Even if it's in the first inning of the first game.
But thank you. Ryan, you have thousands of customers around the Midwest, most of whom have their employees working during this process because they're essential businesses. Talk to us a little bit about what you're hearing from your customers and what recommendations you have.
Yeah, thank you. I think, so I get to see what's going on with, almost 2,000 customers across the Midwest, but also dealing with, the fact that we have several hundred of our own employees. And so I'm dealing with our own internal employees with a couple hundred of them working from home. If I had to just boil down what I feel like, I'll use Dr. Raymond's, if we're in the first or second inning, I'm going to be optimistic and say the second inning. But, I feel like this week, what's really hit home for me is that communication continues to just be paramount. I actually applaud this group for being ahead of communicating often and communicating as much as we know. But what I mean by that is, our own employees and the folks that are working for all of you on this call, they're dealing with, I think, a range of emotions right now that we actually don't know what to deal with. So if you just kind of put yourself in your own shoes, you're dealing with what's happening as you process information. But I know at my household, I'm working like crazy. My wife happens to be in the medical field. She's working like crazy. I now have kids at home that are sitting at home trying to be in school, but they're really not. And then you actually have this collision, so to speak, of what's going on in the news, what's going on in social media. And when you combine all those things together, we are starting to see people react, what I'd say, in an emotional way. And I mean that at all levels of organizations. We have CEOs that are trying to balance being empathetic with being an essential business, and how do we actually keep all the gears in place? We have, as the CARE Act continues to come to fruition, we have balancing the fact that we need to make sure that we have our essential employees doing everything they can and balancing their own health. We also have, some things that have popped up on our end, believe it or not, is, we've had several emails this week from good employees saying, I think I'm going to end up making as much money on unemployment, so I'm going to see if I can go that route. We put all those things together. I'll probably just go back to the main thing I talked about that says communication continues to be the most important thing. Now, to communicate, obviously, you have to have good information. I will say that I think all of us are working hard to be better employers, better at using information and data. And I've actually been impressed with the level of information that both state and local, as well as folks like the MMAC are providing to employers like us and helping band together to create the best information. But again, we have our own employees that we are sealing, and there's just this range of emotion that we have to manage. So I think the good news is I feel like there's a playbook that we are all getting better at. I think the challenging news that we're all trying to figure out is, to Dr. Raymond's point, this is the first or second inning, and the fatigue mentally that I feel like is starting to hit some people is pretty high. So from our standpoint, we're trying to just keep information front and center and communicate as often as possible, as frequently as we can with the information that they need to know. But it's challenging for sure, but looking forward to leading through this with all the leaders around here.
Great. Ryan, what advice would you have for employers, especially as we discussed the trying to stay connected? So people who are not in an essential business or are in a position where they can work from home are now really striving to stay connected. And there's a fear of not being responsive. And so how do you talk to employers about managing that?
Yeah, I think this goes to, this earlier conversation of the emotional impact that everyone's having. And, I think yesterday was a big one for, my previous employer. And, I feel bad for what all retailers are going through right now. But when you read that in one day, 500,000 people in the retail industry are laid off, so to speak, or furloughed, paranoia starts to set in. And this, I'm supposed to be working really hard and doing everything that I can to contribute. And I feel like just being okay with the fact that is a real emotion. I think as leaders and folks that are actually managing folks, we have to make sure that we are putting our people at ease and really measuring what matters and not FaceTime. And it's really easy to do, right? Now that we're all so connected, we feel like we should have everything at our fingertips. What I told one of our customers yesterday was, an hour feels like a week feels like a month, and a month feels like an eternity. And so there's this cautiousness of sometimes you do have to go slow to go fast, because activity doesn't equal productivity.
Yeah, and as companies deal with the financial challenges here, how do you keep from feeling like you have an A team and a B team when you've got to furlough a part of your team as a result of the impact of the financial ramifications of this?
Yeah. So I think everyone's dealing with this choppiness, just like you mentioned, of this A team and B team. But at the end of this, I feel like we do have this obligation, fiduciary, obviously, as running companies. We also have an obligation to our community, and so again, balancing these things is important. And again, I'm going to go back to the word communication. We've had to make some decisions on our end as well that are challenging. And when I explain the why, you get a better response than I think typically you realize. But, if people aren't thinking about the challenging news of what could impact them, I think we're kidding ourselves. I don't care what industry that you're in right now, there's some ramification or unintended consequence that you could be dealing with. And so actually just being very upfront about, here are the things that we're dealing with, here's how we're going to communicate. This is what phase 1 or 2 or 3 could look like if we had to make some tough decisions. It allows people to process in their own way, in their own space, on their own time. And in the absence of communication, people create their own stories. And I'm always a fan of creating your own narrative.
Good. Chris, do we have questions from the audience at all?
Yeah, we had one question for Dr. Raymond. Dr. Raymond, could you discuss the medical benefit of the self-isolation centers the state announced this week?
I don't have enough information to say, but I would also say that for people that can't effectively isolate at home, perhaps they don't have the social or financial support system, these could be a godsend for all of us. So I'd like to know more information, but I think in theory it's good. It's a good idea.
Then another question for Dr. Raymond. Is our lousy weather so far helping with our social distancing?
Good question. I think for our mental health, though, it would be nice to get out for a walk as long as we protect our personal space bubble.
And then one potential question for Ryan. Ryan, for employees of nonprofits that are religiously affiliated that may not be eligible for traditional unemployment insurance, is there any carve out for them in the CARES Act as far as you know?
Yeah, I wish I had the answer to that one, and I don't. I happen to serve on a not-for-profit board, and I know what they're doing, but it's outside of the stimulus package, so to speak. Be happy to look into that and provide help to someone if you want to put me in touch with them. But yeah, I'm probably not the expert on the not-for-profit side.
Great, thank you. And then for Dr. Raymond, we had another question about masks, specifically the homemade ones that are out there. I know there's probably all kinds of different designs out there, but in general, how effective are they and what uses might they have?
Hard question to answer. First of all, there's a lot of variability in the materials used in the masks. But what I would say at a minimum, if it makes you feel better or it sends a message to people around you that you're serious about social isolation, that's a good thing. We don't even know, honestly, whether surgical masks protect you from either giving or getting an infection out in the public. We know they work in hospitals, but more and more I'm starting to believe that we should be wearing masks if we have them when we leave our house. So I think it's probably ultimately a good thing.
All right, and that's all we have in terms of audience questions.
Good, and maybe one more for me for Dr. Raymond. As we look at our neighboring states, do you get a sense that we're on the same page when it comes to social distancing and what we're doing, so that people moving between these borders are coming kind of with the same conditions?
I'm actually concerned about that, Tim. I think we're all doing the same things, started at different times. And it looks like we're behind, which is a good thing, behind Illinois. But we really need to watch to see how they're doing in terms of bending down their curve. If they don't flatten the curve, it's going to make it harder for us to flatten our curve.
Good. Well, Dr. Raymond, Ryan, thank you very much for your time today. We'll be back tomorrow with the next episode, and hopefully we continue the cautiously optimistic trend. So thanks very much for your questions, and join us tomorrow at 3:30. Thank you.
Thank you.
Thanks.